This is our COVID response data and modeling update with Dr. Sarah Line-Callow. I'm going to turn this over to Sarah. We will have a brief opportunity for some Q&A at the end, and we'll have to keep that focused on the data and modeling presentation. Just as a reminder, there is a news conference later on this afternoon, so you can probably get some of those questions addressed there, if not here. So with that, I will turn it over to Dr. Line-Callow. Take it away, Sarah.
Hey, good morning, everyone. Thank you for joining. Continuing to have some encouraging news here in Michigan. So I'm very excited to share this with you. Michigan is holding relatively steady in terms of our national position with case rates, death rates, and hospitalization rates. Within the state, our case rates and percent positivity has been declining for 5 weeks. Case rates were currently at about 112 cases per million. And our percent positivity about 3.9%. These are data that we shared yesterday. I've been looking at more last night's data as well, and our numbers are continuing to trend downwards. Our hospitalization and mortality numbers are also continuing to decline as well. You can see that we had 282 deaths related to COVID-19 between January 31st and February 6th. Our 7-day average state testing rate is about 3,100 tests per million people per day. Our daily diagnostic tests in terms of PCR have decreased, but our weekly average for PCR and antigen tests in Michigan, so any sort of diagnostic test, is about 38,000 tests per day. It's very important that people continue to be tested for COVID-19. You'll be hearing more about the B.1.1.7 variant. It's important that people maintain testing if they consider themselves to be exposed or if they've been traveling. In terms of COVID-19 vaccine, we're at 1.6 million COVID-19 vaccine doses have been reported back to the department. We estimate that 13.7% of the population age 16 and above has had at least one dose of COVID-19 vaccine. And you will hear that over 500,000 people have received 2 doses and are now fully vaccinated. We have a little bit of information for you today about other public health indicators that we're tracking during COVID-19. There's been a lot of interest in suicide and homicide rates, so we have an update for you on that. And we also have some continuing information about the rate of childhood-led testing in the state. And then we're going to finish up with a bit on our science roundup, some summary information regarding our testing in schools and sports, some highlight of information from CDC about double masking, and then some information about vaccination, herd immunity, and finishing up with a comparison to other states. Next slide, please. So many thanks to Michigan Medicine for summarizing where we stand with other states in the nation. There are 2 states, South Dakota and Nebraska, that are seeing increasing 1-week case trends. 32 states have significant outbreaks in the nation. Moving down to the Midwest, you can see that all states are showing a drop or a decline in hospitalization and cases with differing levels of the amount of drop in cases. Next slide, please. In terms of Michigan, our statewide positivity has decreased to 3.9%. It has decreased in all the MARC regions. All 8 regions are now below 7%. The Upper Peninsula is now below 3% positivity. And most of the counties in the state have positivity below 10%. Our case rates have also steadily declined. We're now at 112.9 cases per million people. This is an 85% decrease from mid-November peak, and we're only about 14% higher than we were on October 1st of last year. Fortunately, we're seeing these declines among all age, race, and ethnic groups. And in the past 30 days, less than 1 in 5 cases have had unknown race and ethnicity. So we're able to get our case investigation rates up, and that results in us having better knowledge about race and ethnicity among cases. We are continuing to track variants of the COVID-19 virus in Michigan. In the nation, the B117 variant, which has a 50% increase in transmissibility, there's more than 1,100 cases identified in the nation. In Michigan, we have 157 cases of COVID-19 that are known to have been infected with the B117 variant. These variants are very concerning. We need to have increased vigilance in the use of masks, social distancing, and we need to ensure that people are testing. The number of active outbreaks that local health departments have reported is down 7% from the previous week, and the number of reported school outbreaks have decreased since last week to about 107. Let's get into some detail here. So looking at our postage stamp, the first two colored columns there, overall risk level and absolute cases per million people, have lightened up in terms of the level of purple they're at. All but two of the Merck regions had dropped below 150 cases per million, with declines of more than 30 days in all regions. I took a peek at the numbers last night on my Safe Start map, and now all of those regions have dropped below 150 cases per million. Percent positivity is also on the decline. You can see that we've had steady declines in positivity trend over time. Next slide, please. This is another way to look at those same positivity and cases per million rates over time. You can see we've had a steady decline. It's not as steep as the decline in December, but we're still continuing on the downward path here. Next slide. So drilling into a little bit more geographic detail, looking at testing positivity. This is the map of the percent of tests that are PCR diagnostic tests that are positive in each county. 4 of 83 counties in the state have positivity between 10 and 15%. This is an increase over last week in 3 counties. But in general, the map has lightened up quite a bit from where we were last month. Next slide, please. Looking at age group, this is moving into case rates. This is looking at cases by age group. The 0 to 29 and 30 to 49 year age groups have the highest case rates per million. All 4 age groups here are declining, however. Then this week we added, in the next slide, we looked at the most recent period of time and pulled out age-specific rates by 10-year age groups. So those aged 20 to 29 have the highest case rate during the second surge, followed by ages 30 to 39, 40 to 49, and 50 to 59. But you can also see that all age groups here are experiencing a decline in case rates. Next slide, please. So it's looking at daily new cases per million people by race and ethnicity. Our cases per million are declining for all racial groups, as well as both Hispanic Latino and non-Hispanic Latino groups. Next slide, please. All right, this is talking about the variants of concern. So these are viruses will mutate as they travel through populations. This is an expected part of a pandemic. There are variants that the nation is tracking and World Health Organization is tracking because they behave in ways that impact transmissibility or may impact effectiveness of vaccine. In this case, B117, B1351, and P1 are the 3 variants of concern that are being tracked right now. You can see the number of cases in the nation as a whole. For these kind of results, it's very important to understand that we do not test every case of COVID-19 for, we do not whole genome sequence the sample for every person who's tested positive for COVID-19. So it's important to understand that these numbers are indication that the virus, this variant, is in the area. So you can see for Michigan, we're at about 157 cases of B117 variant have been identified in the state out of the available samples. This number will differ from what you see on CDC's website. We're able to update our data more quickly than CDC can update the nation's data. Next slide, please. You can also see here that the 157 cases per million are, 157 cases of B117 variant are spread across the state. At this time, we have not detected variant in a case in the Upper Peninsula, but we have detected variant in residents of 12 counties. The map on the right has not been updated to the 157 cases if you're quickly summing that up, but I wanted to make sure that we included it just so you could get an idea of the geographic spread of the variant. So our purpose in tracking the variant is to try to slow its spread as much as possible so that we can get as many vulnerable residents or individuals in the state vaccinated, fully vaccinated before that variant can act to increase our case count. So public's action is really essential here in terms of continuing use of masks, social distancing, hand washing. And again, it is important if people have traveled out of Michigan in the past 14 days that they get tested for COVID-19. And if, of course, if someone feels that they've been exposed or if they're symptomatic, they should definitely get tested for COVID-19. Next slide, please. All right, so let's move on to talking about the number of outbreaks that local health departments report they're investigating each week. So the total number of active outbreaks is down 7% from the previous week. We're now at 734 outbreaks that local health reported they're working on. 301 of those outbreaks are occurring in skilled nursing, long-term care, or other assisted living facilities. But the number of new outbreaks in SNFs is only 26. So that's very encouraging. Following long-term care facilities, the greatest number of new outbreaks were reported in manufacturing, construction, which is a very large set of sectors of industry, K through 12 setting, healthcare, and office settings. Next slide, please. In terms of K through 12 school outbreaks, local health reported to us that there were 107 outbreaks that they were tracking in the K through 12 setting. This includes 38 outbreaks in preschool to elementary settings, 21 in junior high and middle school, 44 in high schools, and 4 that were limited to administrative buildings or administrative staff only. One thing I will note is that the range of cases per outbreak, the upper level of that range has increased a bit. We're now at 47 cases in one of the outbreaks being tracked. Next slide, please. So moving on to talk about COVID-19 and healthcare capacity. Some very good news here. Hospitalizations and ICU utilization for COVID-19 continue to decline. COVID-like illness is continuing its downward trend in the emergency department, and we're now at 2% of ER visits have some sort of notation of COVID-like illness. Hospitalizations for COVID-19 are down 79% since the December 1st peak. And our ICU occupancy for COVID-19 has declined 13% over the last week. 7 of the preparedness regions in the state are at or below 15% of adult ICU beds being used to treat patients who are positive for COVID-19. In terms of mortality, the number of deaths from COVID-19 have declined for 7 weeks. We are now 70% decrease from the peak that we experienced on December 10th. And the decrease in mortality has been seen among most age groups, races, and ethnicity groups. Next slide, please. So this is a slide that I'm sure is getting familiar for you. This is looking at our hospitalization trends. This is the number of confirmed positive patients in state hospitals. So hospitals in the state. This week, the COVID-19 positive census in hospitals is down 23% from the previous week and 79% from where we were in December. Looking at that same indicator by region, All preparedness regions in the state are showing decreasing or flat trends in COVID positive hospitalizations. All regions are below 120 hospitalized patients per million population, and 6 of the 8 preparedness regions are below 100 per million rate. Moving on to the ICU, the census of COVID-19 positive patients being treated in the ICU continues to decline. Nearly all regions are showing declining trend. Overall, the state is down 13% from where we were last week. Only preparedness region 5 showed a growth in patients, and we're going to continue to monitor that area to understand why that growth occurred. 6 of 8 regions are at or below 10% of beds occupied by COVID-19 patients. So very, very encouraging signs from the hospital standpoint. Moving on to mortality, we're continuing to see a decline in the number of deaths that are occurring in the state and the deaths per million by age group. The decline has slowed somewhat, and you can see the specific numbers here. Next slide, please. Our 30-day rolling average of mortality among race and ethnicity groups. Death rates are decreasing among all of these groups depicted here. White and non-Hispanic Latino groups have the highest number of reported deaths per capita. But it's important to understand that these are crude death rates. They are not adjusted for confounders such as age and sex. Next slide, please. All right, so how is our public health capacity for response? Our diagnostic testing volume has decreased from last week to about 38,000 tests. That decrease has occurred particularly in the PCR testing. About 13.9% of the diagnostic tests in the state are antigen tests. You're going to hear a little bit more later about how we're making use of some of those tests. The number of cases that have been referred to local health and state health for investigation has plateaued. The proportion of interviews that we're able to complete is holding relatively stable. Unfortunately, we're continuing to see a low proportion of cases who are able to identify a source of their infection, and a low proportion of cases who are quarantining, who report quarantining when their symptoms began. These are concerning to us that this means that we're continuing to see community acquisition of COVID-19, and that our cases are still having opportunities to expose others to their virus at the time that they became symptomatic. So we want to emphasize the importance of quarantining for those who have been exposed. This is an update of our daily diagnostic tests. You can see some of the specifics here. About 7% of the counties are meeting our testing capacity threshold. We'd like that number to go up, and we're working hard to promote the use of antigen tests in a variety of settings. Next slide, please. This is a little bit of detail on our case investigation metrics. Last week, over 6,300 cases were referred to local health for investigation. They were able to complete a case interview for 4,100 of those individuals. Of those individuals interviewed, 45% reported that they knew the source of their COVID-19 infection, and 25% noted that they were quarantining before symptom onset. In terms of COVID-19 vaccination, we are 15th in the nation in terms of the doses administered per 100,000 people. The most exciting part of this slide that I get to share is that we have more than 500,000 people in the state that are now fully vaccinated for COVID-19. It's about 13.7% of people over age 16 and above have had their first dose of vaccine. That's up 2% from the week prior. And we're seeing more than 35% of people over the age of 75 have had at least one dose. In terms of our long-term pharmacy partnership, federal pharmacy partnership, 76% of long-term care facilities enrolled in that partnership have had their first clinic completed. And over 166,000 COVID-19 doses have been provided to residents and staff through that program. And there were 560 clinics scheduled this coming week. So let's get into the detail a bit. This is giving you the picture of where Michigan stands in our state rank for a variety of shipment administration statistics. Also provides you administered doses per 100,000, how our ranking has shifted over time. Next slide. We have more than 2.2 million doses of COVID-19 vaccine has been shipped in the state. That total does include about 500,000 doses that have been distributed through the federal retail pharmacy and long-term care pharmacy partnership programs. We have 1.6 million doses that have been reported back to us as being administered. And that includes 1.1 million first doses and over 500,000 second doses. Next slide, please. In terms of age group, we see that more than 561,000 people aged 65 years and older have received one or more doses of vaccine. That's up 25% from last week. Persons over the age of 75 have the highest initiation coverage, meaning that they have at least their first dose. That's 35% of that population now. Looking at all the doses that have been distributed or administered in the past week, about 34% of all vaccine administered was given as a first dose to people age 65 and older. Next slide. This is data that you can see on our website as well. It's providing the number of doses that are administered each day by either first dose or second dose. We have had 10 days administering more than 50,000 doses per day. The state is capable of doing more than that. We know that from all the requests for vaccine that we receive. And there's been at least one day where we've vaccinated more than 65,000 doses. Next slide, please. This is a bit of detail about the Federal Long-Term Care Facility Pharmacy Partnership Program. That's the longest title ever. The percent of long-term care facilities enrolled in the program who've had a first clinic completed is at 76%. And you can see that the number of second clinics completed for skilled nursing facilities is climbing. We're at about 89% of CVS Part A facilities have had their second clinic. You can see the number of clinics that are scheduled in the next 7 days. Next slide, please. So talking about other public health indicators, we're presenting some data to you today on Michigan homicide and suicide rates. These data are numbers. These data are from our National Violent Death Reporting System. You're going to see that suicides during 2020 were trending relatively similarly to 2019. Homicides in 2020 are up slightly compared to 2019. We also have some data to share on the percent of children under age 6 who have been tested for lead. We're at about a 37% reduction in 2020 compared to 2019, which is similar to other states reporting. Let's get into some of the detail. So these two graphics are presenting information from the National Violent Death Review. This is a CDC-funded program where deaths due to suspected of suicide or homicide are referred to an abstractor who goes through and looks at medical records as well as autopsy information and determines, based on a national case definition, whether this meets a surveillance definition of suicide or homicide. Historically, our death certificates for these kind of violent deaths are received within 4 months of death. So that's why you can see we are presenting data to you in July, ending July. So looking at the two graphics, you can see that the number of suicide deaths per month for 2020, the orange line is very similar to the blue line. Looking at homicide, we saw that the number of homicide deaths in 2020 was higher during the months of June and July, as well as in March than it was in 2019. Moving on to childhood blood lead testing. We're very interested in the use of preventative services in the state, particularly for children. As we know, the utilization of in-person primary care and preventative health services has declined during the pandemic, which will affect childhood-led testing, immunizations, other kind of child services. In this case, the orange line is giving you the monthly numbers of children under age 6 who were tested for blood lead levels. You can see the orange line in 2020 is much lower than the line in 2019. We're at about my apologies, a 35% reduction, not a 37%, a 35% reduction in the number of children under age 6 that were tested for blood lead between January and November of 2020 compared to the same period in 2019. So it's a similar reduction that is seen in other states. There was just an MMWR report that came out looking at decreases between January and May. And we're working to build awareness about this gap that we have. We've been sharing data with Medicaid and local public health to help them identify children who are due for lead testing. And we're partnering with provider organizations such as the Michigan chapter of American Academy of Pediatrics so that pediatricians are aware of this overall drop in lead testing. And we're also conducting targeted outreach to provider practices, try and get these numbers up. Next slide, please. All right, moving into Science Roundup. We have a variety of subjects here today for you. A couple of slides on our pilot testing in schools and sports and the importance of early detection of infected individuals in those pilots. We have an update for you on masking and the potential benefits of double masking. We have some illustrative projections of increased vaccine supply and what that could mean for our goal of reaching herd immunity in the state. We also have compared Michigan to other Midwestern states, and we're looking at a ridge projection to see where we think cases and deaths are projected to continue to decline or not. Now, I don't have these data slides for you today, but did want to share that our most recent mobility data shows some return towards baseline mobility patterns, particularly non-essential visits. All right, so let's jump into the fall sports testing pilot. This was a pilot conducted by the department in partnership with Michigan High School Athletic Association. There were asymptomatic high school athletes were tested 3 times a week. Athletes were participating in football, volleyball, swimming, and diving. One of the advantages of these antigen tests is that we were able to train coaches and volunteers so they could administer these tests. So we did not have to have medical staff involved, which of course increases the access to this kind of testing. It's really important to understand that this testing occurred among athletes after they had already been screened for symptoms. So this is testing among those who are asymptomatic. We had more than 8,300 participants. Out of that, we identified 75 positive tests. 40 of those individuals were identified on their first test. Next slide, please. So what we learned from this pilot is that it is feasible to administer tests in school. That was a very important finding. Testing did pick up asymptomatic cases. So there were 69 confirmed cases of COVID-19 in asymptomatic participants. This is about 1% of the participants. However, it's important that we pick up those sort of asymptomatic individuals to prevent infection of others. And again, most of those individuals were picked up on their first test. So I know there's been questions about the antigen test in terms of whether or not they can perform. And what we saw in this testing pilot is that they indeed can perform. Next slide, please. So we're continuing a winter schools testing program. Been offering educator testing once a week. This is a voluntary program. It's for educators who have face-to-face interaction with students. And there's about 460 schools participating right now. We're also continuing to conduct sports testing. It's about 518 schools that have signed up. We have, for those sports where you cannot wear a mask during active play, we have testing up to 3 times a week. And there's also voluntary testing available for sports where you can wear a mask, and we offer that once a week. All right, moving into the CDC study on double masking, or update on masks. So you can see the reference below. This was work that CDC did. They conducted 2 experiments using dummies, different kinds of masks. So when you have 2 dummies sitting across from each other, and you have the person who is simulating coughing, not wearing a mask, they're measuring the particles that were blocked by the mask for the recipient of that cough. So wearing just a cloth mask blocked about a little bit more than half of the particles, as did a medical mask. So the figures up at the top of the slide, figure 1 is showing an unknotted medical procedure mask. And a little circle on that picture is indicating where there's a gap in that mask. These kind of masks are meant to protect medical professionals from splashing and that kind of thing. But as you can see, they do allow some airflow out of those kind of gaps. Figure B is a medical mask, and that mask blocked about 56, I'm sorry. Figure C are knotted and tucked medical mask. So if you take that, that sort of blue paper mask there, and you knot the earpieces, and then you tuck the mask in carefully, it prevents that gapping. And by preventing that gapping, it blocked 77% of particles. So you had an improvement in the performance of that mask in terms of protecting the recipient in this study. CDC then took a double mask, and there you could see that if you were wearing a double mask and you were exposed to somebody unmasked who coughed at you, that double masking blocked about 85% of the aerosolized particles. The second experiment they performed was having 2 dummies sitting next to each other and just having quiet breathing. And they looked at whether or not the source was unmasked and the different kinds of masking that the recipient would wear. So if the receiver was wearing a knotted and tucked medical mask, it blocked about 65% of the particles from quiet breathing. If the receiver was wearing a double mask, it blocked about 83% of the particles. But the best situation to be in is that both the source and the receiver are wearing double masks or medical masks that are knotted and tucked properly. Then we have we have 96% reduction in particle exposure. Next slide, please. So a quicker summary of that is in this infographic. So the extent to which masks reduce exhalation and inhalation of particle size varies because of the side gaps in these kind of masks. So in lab tests with dummies, exposure to potentially infectious aerosols decreased about 95% when both dummies were wearing tightly fitted masks. So it's very important that everyone wear masks. And this is how we're going to be able to prevent the variants like B117 from causing our case rates to increase again. Next slide, please. So moving into talking about our vaccine supply, I want to thank the University of Michigan School of Public Health for doing some illustrative projections here. So these are illustrations only. The actual timeline will probably vary on this. But what they did was they looked at the pledges that have been announced from Pfizer and Moderna of the 300 million doses of Pfizer and 300 million doses of Moderna that would be available by the end of July. And they looked at based on the Michigan's percent of the US population, how much of those vaccines may come to the state. And then they spread those pledged doses out evenly between March and July. So a couple of take-homes from this slide that I see. One is you can see the difference between the amount of vaccine that is projected to come in versus what we have been receiving. So it'll be great when we get to March, April, and our vaccine supply increases because there are so many willing participants to get doses in people's arms. Even with this projected 600 million doses, we are expecting that we would reach 50% of Michigan's eligible population having 2 doses of vaccine in end of May, mid-May. So that's that 50% dashed line there. So this is we're just trying to find ways to get across how much vaccine we have available currently, where we hope to be. This illustration does not depict Johnson & Johnson and AstraZeneca, which we know will follow soon. But our expectation is that our vaccination supply will increase, hopefully in March. Next slide, please. All right, the other thing that we share on our science roundup is we did spend some time looking at Michigan relative to the other states in the nation. This is the 7-day average daily cases per million rate. And these are data that we pulled right off of CDC's website. Michigan is the sort of teal green. It is the bottom line for the most of the graphic here. But what you can see is that we know there are overall declines in case rates across the country, and we're seeing those declines here in the Midwest as well. And Michigan's case rates are among the lowest among our neighboring states. And then the last slide, I want to share a bit of projections with you. So this is, again, many thanks to the University of Michigan School of Public Health. Basically, they performed a ridge regression projection. So looking for cases on the left and deaths on the right, we can say that we're projecting to continue to have declining rates in the state for both of these metrics. Right, that's what I had to share with you today. Thank you very much for your attention. I look forward to your questions.
Okay, thank you, Dr. Longcallow. Failed to introduce myself at the beginning. So for the record, this is Lynn Sutton, Public Information Officer here at MDHHS. As usual, we'll start some questions. Please raise your hand. You'll be limited to 1 question. Please introduce yourself and your outlet so that that can be also caught into the record here for the tape. So I'm going to start with Catherine Wells. Please unmute yourself and ask your question.
Yeah, hi, this is Kate Wells with Michigan Radio NPR. Thanks for taking my question, Lynn. And Sarah, thank you so much for doing this briefing. Man, there was a lot in this, but my main question is primarily about vaccinations and what data, if any, the state has about vaccinations by race. What percentage, even if it's imperfect or incomplete data, is getting to minorities, to people of color? What do we know about that, and what can you share?
Yep, very, very good question. Very, very important subject. We're continuing to work on our race data. I think it's already been reported that we're about 44% of our data on race and ethnicity, 44% of our vaccination administration records that come back to us are lacking race data. We've been working through different kinds of linkages that we can do within the state data system to try and improve those numbers. We've also been working with hospitals and local health departments to make sure that the electronic messaging that we're receiving, that we have the triggers set appropriately on those messages so that we're not somehow excluding that information as it's coming back in. And we've also been working on a direct entry tool so that as someone is being vaccinated, if that vaccine is being recorded directly into the MICR, the Michigan, I apologize for the acronyms, into the Michigan Care Improvement Registry, that person's race, ethnicity could be recorded at that point if it's missing. So we're working on those fronts to try and improve this information. And we're eager to get this information out so that it is visible to you all and the public.
Sarah, sorry, just a quick follow-up on that. So I understand that 44% there, you guys just aren't getting, but if the data that you are getting, what is that telling you in terms of the numbers of by race?
Kate will be reporting that information out shortly, but at this time we're not, giving that information because we do feel it's very incomplete. So I'm going to move on now to Courtney. Can you unmute yourself, Courtney Benton, and ask your question?
Yes, thank you. So I'm from Mid-Michigan Now, NBC 25 and Fox 66. And I'm wondering, why are people getting vaccinated that are outside the allocated groups? And then can you talk a little bit about why some places this week in particular, healthcare facilities and health departments did not receive any of the first doses?
Sure. So our guidance that we have on prioritization of the vaccine during times of scarcity, we want to make sure that people who are over age 65 and older are able to get vaccinated, as well as healthcare workers, first responders, and then we've just started being able to open up to a couple of other frontline essential workers. So these are people who cannot work from home, who have lack of ability to control social distancing within their employment. And we're trying to balance supply and demand in terms of opening up those criteria. However, it is very important that we not waste any vaccine. So if there are doses left at the end of a day, if there are individuals who are being who are available to have those doses provided to them, we want to make sure that we are not wasting any vaccine at all. A dose in someone's arm is better than a dose in the trash can. So it's important to understand that this is guidance that we're providing, but that a clinically appropriate dose is an important dose to be providing. In terms of, I'm sorry, I forgot the second part of your question.
Yeah, so we heard that some healthcare facilities and health departments didn't receive any doses this week for the first dose in particular. Why is that?
Sure. So there were a number of, we spent quite a bit of time over the past 2 weeks working with vaccine providers to understand where their inventory stood with having second doses available. So it's very important that, given that these are 2-dose series of vaccination, that people get that second dose in. So we did spend some time making sure that second doses were available for people whose time was up, who'd had a first dose and they were due for their second dose. In going through that reconciliation process, we had to go into our first dose allocation in order to make all of those second doses available.
Okay, thank you. Lindsay, you want to unmute yourself and ask your question, please?
Yes, hi, thank you. This is Lindsay McComal with Wood TV in Grand Rapids. My question is related to folks who are in long-term care facilities and going through that process of getting them vaccinated. A lot of people who have loved ones in those facilities are obviously very, very anxious to see those restrictions lift and be able to see them again, hug them again. Obviously, that process is still ongoing, but can you share any insight on if there is a timeline for when we may see changes in regards to those restrictions? And even within the facilities themselves, a lot of the residents remain isolated, even if they have already received one of their doses. Do we know when that may change and when they might be able to have some interaction again?
So it's important to understand that you need your second dose of vaccine before you can be considered immune. So technically it's your second dose plus 2 weeks for your immune system to absorb that. I'm not able to comment on the timing today of any changes that may be coming for nursing homes. But I do want to make sure that there's clear understanding that you need 2 doses of vaccine for Pfizer and Moderna to be considered fully vaccinated. Thanks.
Okay. Okay, thank you very much. This is all the time we have today. I know there were a couple outstanding questions. Please feel free to follow up with me and I will get some answers for you. I appreciate Dr. Lancallo taking the time to present this information. I will be sharing the presentation as well as a link to the video this afternoon. Have a great day, everyone.